Welcome to Comfort and Growth, the podcast for people who are excited and passionate about personal growth and productivity. You can tell I'm super excited today because I have one of my favorite people, my chief physician, Victoria. Yay!
Hello, everybody.
Victoria,
Yes.
you are one of my favorite people because you cure me of everything that ails me, from my carpal tunnel to my insomnia and my jet lag.
I'm happy for you.
Can you introduce yourself to our audience and let them know a little bit about who you are, what you do, and your career story?
Yeah, sure. So, hi, I'm Victoria. I'm a TCM physician. I'm a clinician, researcher, and a mentor in TCM. So, I graduated from a double degree program in NTU and Beijing University of Chinese Medicine. So this double degree program encompasses biomedical sciences and Chinese medicine. So I graduated from there after 5.5 years, and with the license to practice, that's when I entered the workforce at the age of 24.
Wow.
I think 2016. Yeah.
Yes.
So it's been about 8 years now. I've been a full-time physician.
Yes.
And I am now the chief physician of Common TCM.
Yes. What are the most common things that people come to see you for? Because, our audience really is interested in how to take care of themselves, because you can't give from an empty well. Everyone's so big into self-care and taking care of themselves. Share a
Yes.
little bit.
I already feel very comfortable speaking to your audience because I'm seeing a lot of your followers.
That's right.
You have a
Send
lot
them
of
your way.
influence. Yeah, so they're all very inspired by your journey. And then they're all coming to see, for generic wellness or for certain conditions.
Yes.
But really, I think not just for me, but for physicians and clinics in the industry, we are seeing like 50% is at least some kind of pain.
Yeah.
Can be neck pain, back
Yes.
pain,
Yes.
ankle sprain.
Yo, I feel already. I feel as you're talking, I'm like, neck pain, shoulder pain.
That's me, right? Yeah, but because TCM in Singapore, at least, it's very well known for pain management. So when you sprain an ankle, you kind of, your old folks or your father and mother will tell you, okay, why don't you go to a TCM, the Twina or the Tieta, right? So to get
Yes.
it fixed, bone setting and all that.
Yes.
So really, that's how it started, and 50% of who we see is that. I do a lot of facial and cranial sacral alignment as well.
Yes.
So that's where the musculoskeletal that you have been doing as well. So that one is more on the face, joints, the bones, and the fascia of
Yes.
the top part of our body,
Yes.
chest, head, and all that. And eventually, actually, we see the whole body because the jaw joint, it connects to the neck joint, the cervical spine,
Yeah.
then your thoracic, your lumbar, your sacral. So really it leads downwards, and then eventually, all kinds of pain conditions.
I know.
Yeah, so that's that. And then the other part that I see a lot of is facial aesthetics, actually, and all kinds of skin conditions.
Yes.
Like eczema, acne, psoriasis. I think this is one of the conditions that conventional medicine hasn't been able to treat very well
Yeah.
or treat at its root. Yeah, so it keeps coming back, the condition. Eczema sufferers,
Yes.
they have that itch and that rash on a daily basis for
Yes.
some. Yeah, so TCM has been very helpful for them.
Oh my
Yeah,
God,
so
I didn't
that's what
even
we
know
see.
that you did eczema, because I am somebody who's an itchy sleeper. And when I sleep, I actually have like a tub of anti-itch cream and all of that next to my bed, because like 50% of the time I'll wake up with some random itchiness.
Right.
And then I'll have to do it. So I didn't even know, since I've been seeing you, that TCM can help with that.
Next time, okay? You tell me. So the
Yes.
skin itch is actually, we view skin conditions as like a reflection of our inner health as well. So we kind of deep dive into what is wrong with you first
Yes.
before we kind of find out why you have the skin condition.
Yes.
Yeah, so that's how we usually treat skin conditions.
So Victoria,
Yes.
for our viewers, can you explain what is the philosophy behind acupuncture?
Right.
What is it actually about, and how does it work?
So acupuncture, in short, does three main things, right? So number one, because of the microtrauma to the skin, since we insert it on the skin surface, it helps with blood circulation and it helps with blood flow. So if any condition that requires us to relax the muscle, to engage more blood over to a certain area, like a localized area, that is extremely beneficial. The second part is that it helps relax the nervous system. Because in fact, it has been researched that, thousands of years ago when acupoints came into existence and the meridian pathways were researched, they found out that all these points, they are very, very near to nerves. And I would call them nerve points.
Yep.
I rather term them as nerve points because they are easier to understand. So when you target nerves, when you do the acupuncture on those points, you are essentially trying to heal the nerves. So if there is any nerve compression, impingement, some sort of damage to that area, then the acupuncture would help to accelerate the recovery of the nerve.
So we have a lot of people asking if you could give them some of your top tips for improving like health in general.
Okay, maybe before we go into tips,
Sure.
the way that TCM sees health in general, or how we discover and investigate illnesses is from two factors. So one is the external, one is the internal. So the external factor is, okay, maybe you got caught in the rain and then you fell sick. So that's like cold weather, right?
Yep.
That's external. Or maybe you caught a virus and you fell sick. So the internal part comes from three areas. It's your diet, your dietary habits, emotion management, and also like overexertion. So let's say you work too hard, you don't eat well, and you sleep late because you're stressed or different factors, and that's actually causes and factors that can eventually lead to illnesses. So to prevent and maintain that, we have to target these three that we can control, right? The internal one. So of course, the first one is dietary. I would say for dietary habits, it is not true that everyone should avoid cold drinks, actually.
Oh, my dad always said that.
Yeah.
No ice and
I
no
love
cold.
to debunk myths.
Okay, great. Yes.
So basically, the thing about cold is that it will bring down your body temperature, it will constrict your blood vessels, and it will make your digestive rate or your metabolic rate slower.
Yep.
Right? But that's not true that you should avoid it altogether if your body is not is not weak, or is your body's metabolic function is not weak.
Right.
So if you run on a very high engine and your metabolic rate is high,
Yes.
you can from time to time drink cold water.
How about, does it also depend on the weather? Like if it's very hot, it's okay, but if it's like rainy, then don't drink too much cold water
Yeah,
or
so
what?
if you find that you are sweating a bit too much because the weather is hot, your body is trying to expel, right? You can drink cold water to temporarily bring down your body temperature, and then of course you don't indulge lah. Yeah,
Yes.
so it's actually okay. But
Wow.
the thing of not okay is that when someone drinks cold water permanently, like
Okay.
every drink of the day.
Right.
Yeah, if I have patients like that, I'll be like, okay, why don't we take it one step at a time? Ask for less ice, number one. Right? Ask for less ice first. Then you put like 1 cube, 2 cube. Just try to get used to the temperature of being like drinking room temperature.
Yeah.
Because it's going to slow down our metabolic rate.
Yes.
And if let's say you happen to have a very weak digestion or you get bloated easily, it doesn't help you.
Oh my God, but I love that you said like it's not like a hard and fast
it's not a
rule.
blanket solution.
Yeah, because like every time, I honestly love drinking cold water sometimes. I also love hot beverages, but whenever I drink cold water, I feel like, my body like wants it when it's really hot outside, but I feel guilty because I
understand.
hear my dad's voice going like, don't drink cold water, it stops your digestion.
I think if it helps you, I drink cold water as well.
Yay,
Yeah.
happy.
So I try to limit myself to like just half a cup.
Okay.
Yeah, half a cup if I'm really, really like hot, I'm thirsty.
Yes.
Then the rest of my drink, like for the day, would
Okay.
be warm or room temperature.
I was just going to ask you, so like in terms of beverages, what is like the best
the
beverage?
best drink.
Yeah.
I think scientifically the best is sugar-free drinks.
yes.
Yeah, so really anything like water, tea, non-sugar tea, and even if tea, I mean herbal teas.
Yes.
So like the English tea is
Yeah.
actually, there's a nature to that. So English tea is actually quite cooling. It can cause more discharge in women.
Yes.
I mean, that really depends. So the best drink is really just plain water or something like matcha, something that's a lot of antioxidants.
Yes.
Some maybe herbal teas like peppermint tea,
Yes.
chamomile is okay.
Okay.
Yeah, anything that's not sugary, it's okay to drink.
And also, I love your teas. I genuinely love
Thank
your
you.
line of teas. Victoria has her own line of
Yes.
teas as well. Yeah, which we'll come back to later on.
Yes.
Okay, so the first tip is like cold water is okay, but not too much.
Yes.
And then drink lots of...
Don't overindulge.
Yes.
Yes, you
Okay.
can drink cold water.
Yes.
And also try non-sugar drinks.
Okay.
Yeah, okay. And then we got the sleep function, right?
Mm-hmm.
So I think we talked about this before, like breath work. So basically, one of the factors, remember the internal factors, is that your emotion management.
Yes.
And this includes anger, irritability, stress management. All
Yes.
these needs to be managed well in a way. Like we all need to find an output for our stress.
Yes.
Yeah, and our anger, of course. And when someone doesn't find an appropriate output for themselves, they tend to pan it up, right? And this leads to illnesses. Yeah. So breathwork is important. I always say the 4-7-8 technique. The breathe in with your nose 4 counts, hold for 7, and breathe out with your mouth 8 counts.
Yeah, we do that too.
Yes, we talked about that. So,
Yes.
so that is actually a very, very good technique when you are stressed, and you can do it anytime you want, on your desk or
Yes.
on bed, right? Before you
Yes.
sleep. It really helps to introduce a lot of oxygen into your system.
Yes.
It helps to calm you down and reduce inflammation in the system
Right.
overall. So with that, less stress, less tension in the body, you sleep better as well.
Yes, I'm doing it right now. Breathing in for 4, hold my breath for 7, and then breathe out for 8. Because like the science behind it is that the exhales being longer than the inhales
Yes.
actually activates the parasympathetic nervous system that
Correct.
slows down your heart rate. So good.
That's what we do in TCM as well.
Yeah.
So we use acupuncture to help stimulate the parasympathetic system. Yeah, it's a very good technique to help those who are having high stress levels most of the day.
Yes.
Because maybe work, maybe family. Yeah, and acupuncture, like this set of acupuncture points, targets all the important nerve points on the body
Yes.
to help engage that system and
Yes.
to let us breathe better. Helps to calm us down. Our system gets more toned down, and then we are able to relax better.
Great. So we heard about hydration, and then we're hearing about our breathing.
Breathing,
and
which
then
helps
what
to
else?
sleep. And I think the last tip is, it's not really something you do, but something we should keep in mind is that we have to be intentional about the habits that we cultivate for ourselves.
Yeah.
So if we have a bad habit, then we need to be intentional about switching it up to a good habit, right? And even for meal times, we should be intentional about catering at least 45 minutes to having a meal. Yeah, so a lot of people don't do that, and they just live day to day, hurrying from one meeting to another
Yeah.
without having a stop for themselves. So being intentional about leaving these gaps for yourself is important. It's such a simple advice, but really not everyone does it. So
Yes.
it's just a very, very good reminder at this point.
I love that. And I honestly swear by this saying, like, leave a margin. It's
yes.
just like, when we have our 听写簿, our spelling books, we
Yes.
had to draw a margin
Right.
in the side, right?
Right.
But like, I really feel like a lot of us, especially during COVID, we got used to having, say, Zoom meetings. And a Zoom meeting, because there's no need for you to travel from A to B to meeting room, whatever, it's like 8 o'clock, then 9 o'clock, then 10 o'clock, then whatever.
Right.
And then we got used to like not having those slices of time
That
in
margin
between.
of time.
The
Yeah,
margin.
yes.
And I think particularly some interesting research has shown that if you're optimist like me, I'm very optimistic, it tends to be that we overestimate the amount of things that we can get done, and we underestimate like the time it takes for us to like get to places.
Right.
Yeah, and then we end up having this
happens.
very like frazzled
You're like, 5 minutes here and then
Yeah.
cut 5 minutes there.
Can
and then,
lah.
it's okay. Yeah, I guess coming back to the point, right? We have to be aware that we are doing that in
Yeah.
the first place
Yes.
to be able to change anything at all.
For sure.
So if you know that, you tend to do that, then constantly remind yourself that,
What do you do
yeah.
when you're stacked? Like, I know you get so busy.
yeah.
Like, how do you like actually remind yourself to breathe and
I
do
don't
all
know
this?
if I should say this because
Yeah, say.
so right, like we have back-to-back patients, right?
Yes.
And sometimes, okay, for example, I'll just give you a time. Like maybe 3:30 is one person,
Yeah.
and then 4:15 is another one.
Yes.
Okay, so 3:30 I see, and maybe I'm done at 4:05.
Yep.
And then the 4:15 patient comes at 4:05. Maybe
Yes.
comes early.
Yes.
But because they have an appointed time, right? I
Yes.
could see them if since I'm free.
Uh-huh.
But then I will go to the pantry and I will drink a cup of water very slowly. Then my assistant will come and tell me, oh, so and so is here, like for their appointment. I said, oh, what time is their appointment? It's like 4:15. I said, okay, give me 5 minutes. So so it's about really just giving time to myself.
I love that.
And I think that's intentional.
Yes.
Like I know I could see somebody, but it's okay because I have time.
But
Like
that's your time.
Yes.
You need that time to heal
a
and
lot of
to
people
refocus.
don't. Yeah, a lot of people just don't think that. They think that okay, this time is work time, so if I have that 5 minutes more to spare, I'll give it to someone else. You know, yeah. And
I believe it. But
and,
over
yeah.
time, those thin slices of time,
Yeah.
they like we need them. And if we don't have them, then we
Correct.
don't have the opportunity to reset.
yes, it's not really because we want to just take all the time to rest, but
Yes.
that rest was for the better. It was to like maybe clear your mind,
Yes.
to see the next person better, or to handle the next meeting better.
I think it's also really important because sometimes I'm like a big believer in like energy. Sometimes if you're dealing with, and it happens all the time, sometimes like if the energy is a bit weird with your last meeting or you're feeling a little stressed or maybe you had a difficult conversation.
Yeah.
If you don't actually take that slice to reset, it can contaminate the rest
The
of your
next
meetings.
one,
And then it's
yes.
like everyone after that is a knock-on impact.
Yes, and you will be constantly distracted, right, by
Yes.
the negativity that
Yes.
happened previously. You
Yeah
keep
lor.
thinking about it.
Yes.
Yeah, so it's very important that
Oh.
everybody take a break time.
Yes. I love your
Yes.
drinking water slowly practice.
Just, it doesn't take a lot of time, right?
It
5
doesn't.
minutes and just take a sip. Or
Yes.
Yeah,
Mindful sipping. Yeah, that is so good.
just let me take a sip.
Sure. Okay, mindful sipping tab, yeah, refresh. So I want to pivot a little bit into your own personal story, Victoria. You know, you are one of those few female physicians in traditionally a very male-dominated and older male-dominated field. And then I remember asking you about your training, and you said that you were in China
Yes.
for your training,
Yes.
working in those like public hospitals and
Correct.
seeing lots of people. Can you tell us a little bit about that experience and what actually gave you the courage to like go through such a like out of the ordinary, not a typical Singaporean, not every Singaporean would have dared to do what you did.
Right. So part of the course of the university degree was we had to. So every undergrad would have to go to Beijing, China for
Yes.
2 years for the
Yes.
training.
Yes.
And it's like a full-time clinical internship at the different departments in China hospital. Yeah, so we would rotate around the different departments and then we follow different professors, learn under them and write like our patient notes.
Yeah.
So that is a full 2 years in China.
Yes.
Yes, and that is the requirement to graduate. So that journey actually was maybe 20% anxiety, 80% excitement actually. Yeah.
Okay.
So yeah, but if you were to say, the advice that for people who are considering going to a new environment or
Yes.
what made me, feel better about going there is that
Yes.
I realized that the main thing why we have anxiety is because of the notion of uncertainty.
Yes.
So we don't really know what's going to happen in a new environment. And to lessen anxiety actually is to know more about it, right? So fortunately, I had a lot of seniors who were there. I'm the 7th batch. So there were 6 years of seniors who went there already.
Yes.
And so what I did was I asked many seniors about the life there, sent me pictures of the hospital, and because we took over the apartment from them as well. So we would have photos, some visual, some visual aid to kind of visualize what's like
Yeah.
to live in China.
Having a sense of like what you're going to anticipate.
Yes,
So
and
helpful.
that really helped in feeling less anxious.
Yep.
Yeah, because when you arrive there, everything looks familiar because I've seen them in the photos before.
Yeah.
And
It's a
I think
great tip.
and also when you go through the whole application, we know when you go through like visa application, it takes a long time.
Yep.
So that gives enough leeway, to think about it, to sort of settle. But really, it's a real thing because even my classmates and every batch, we have the same problem is that at the 3rd year, because the 4th year we would go to China.
Yes.
At the 3rd year, many people drop out.
Ah.
Yeah. And we have a percentage of students who would just go with the 1 degree because it's a double degree. So
Yes.
they would continue the 4th year with the biomedical science, and then they will graduate with that and not go to China at all. And so
Right.
they would sort of give up their Chinese medical degree. Yeah,
That's such a
so
shame.
it's a real thing, like anxiousness and stress over living in a new place altogether.
Right. What was the biggest moment of culture shock for you?
Oh, let me think. The toilets. Have you been to China?
Yes, of course, many times.
So when we were traveling in China, actually not really in the more modern cities, like Shanghai, Beijing is still considered
Yes.
modern, but we traveled, right? So
Yeah.
we would go to the more suburbs area, and the toilets were lined as a drain, like
It's a trench.
long,
Yeah, it's like a long
drain.
longgang, like we say in
like a
Singapore. It's
longgang,
like-
yes.
yeah.
And then there were no doors.
Yes.
Just little planks, and you just squat beside each other. Maybe you can see over, you don't know, right?
Yes.
And then everyone just squats down and do their business and go
Yeah.
off. So if you walk past that longgang, you can actually see somebody else's butt.
Yes.
It was quite a culture shock. Lah.
Yeah.
We are the only ones feeling odd.
Yeah.
Since it's the first time we're looking at other people's butts, right? So
I remember Greg went into one of those toilets
he get
before.
a shock?
He walked in and he was like, he didn't walk straight out. He said, "There's no toilet," and I said, "There is. It's that long thing on the floor." And
you're supposed to pee in it.
Yeah.
And do your big business as well in there.
Yes.
So that was quite a shock. Lah,
how
because
about in the
smell.
how about in the hospitals
Right.
though? Like, was there like a working culture shock? Were they very different in their working culture from Singapore?
I think in hospitals, because the hospital in China, they are mostly integrated. So
Right.
Western and Chinese medicine
Yes.
are both practiced in the hospital,
Ah.
including the herbs and drugs. They're all dispensed in the same hospital.
Wow.
So it's very, very different from the Singapore
Yes.
scene. So what happens is I was quite impressed actually at the amount of cooperation between the different doctors and the different
Wow.
departments, because much alike to a hospital in Singapore, there are
Yes.
departments,
Yes.
right? So there is actually an acupuncture department, there is an oncology department, there
Yes.
is pediatrics, the usual, right? But the doctors in there, they are all well versed in both, because when you study medicine in China as a China doctor, you have to know both. Yes, and when they are all well versed in that, they are able to communicate with each other and relate like how to use the medicines, which one do we prefer for this patient, you know, do we use Chinese medicine or do we use Western, and then we go for imaging all at the same place.
Yeah.
So the level of cooperation and the kind of seamless connectivity between them is something that really impressed me, compared to, you know, the Singapore hospitals.
Yeah, that's
here.
incredible. Okay, so Victoria, I want to ask you about what attracted you to TCM.
I think there is actually a backstory there to what attracted me to choose TCM. The course itself is when I was growing up, I was a very active child. So I was involved in multiple CCAs, and then you still need to study, right? So that made me constantly quite tired and lethargic. And, you know, morning school is a drag. So with all that commitment, my mom used to brew me herbal tonic soups, like on a daily basis,
Yum.
because she saw I was really, really tired. And that did change me as a child already, because I did feel a lot more energized, and it really, really helped with my productivity at school.
Yes.
So as a child, I wasn't unfamiliar with herbs. I know it works, and, you know, I had a good impression of it. Yeah, so when I grew up, and then, you know, obviously I'm from the double degree program, it's the university course. When there was this option, I took a look at it. I was like, okay, I am interested in the medical field. I trust in TCM. I know it works.
Yes.
And there is also the biomedical degree. So we got to learn like East and West. So it was like a best of both worlds for me.
Yeah.
And naturally with that degree, we would graduate, and then we took the license to practice. And then, so that was my first career job.
Decision.
Yeah, decision.
Did you always
After
want to be
graduation.
an entrepreneur and set up your own clinic?
When I started working, I was not an employer, so I was working at other private clinics.
Yes.
And throughout the course of working, you know, under others, you know, as an employee, I realized that there were visions and there were things that I wanted to bring out in the TCM industry. And when I tried to implement them in the previous companies that I was at, it felt like a hand too short, you know. Sometimes maybe because of the vision of the company, sometimes it's the management, the leadership. You don't really get to do all the things that you want to do when you're working for somebody. So that's when the decision was made to, you know what, I can and I have the ability to open a clinic because I have the skills and that is enough, right, for a clinic at least. So I decided, okay, let's just explore that option. And then
Was that appealing for you for any other reason other than, did you want the freedom or did you have a vision which is for what it could be?
I guess coming back to the part where, I was acquainted with herbs and I know that TCM works, right? But
Yes.
there was also one point where my friend was very kind. He brought me to a clinic, a TCM clinic, when I
Yeah.
sprained my ankle.
Yeah.
So that visit actually changed my perspective, is that I didn't receive a very clear diagnosis or a treatment plan of what I was suffering from or what I had and what I would be doing to heal. And therefore, I realized that the difference in having a good treatment plan and a good physician
Yes.
does make a difference in your healing journey.
You felt I can do better.
Yeah, I did, and you put it another way.
Yeah.
It's something like that. It's almost like if someone has the skills and
Yes.
is a professional in that, then the only difference in creating a good experience for the patient in a patient-centered environment is really the communication factor and the entire experience as a whole. And that is not just a skill set thing. That is also like how you explain the kind of concepts you're bringing and
Yes.
how do you educate people to take care of themselves better. So that is something I feel really, really spurred me to create like the clinic, like Common TCM, and bring out all those experiences.
Yeah, I think that's something that I hear time and again from entrepreneurs is like they had an experience that was lacking, and it's always like, I spotted this opportunity, I spotted this gap in the market, and then like I thought, like, why not? Why not take this?
Yeah.
and,
Just
and
not
good
enough. Not enough people are doing it right.
For
I
sure.
feel,
Yeah.
and throughout, of course, the course of my career, so many people, so many patients would tell me about the experiences that they have had elsewhere at
Yeah.
other TCM clinics. And it was just very discouraging for me because I also wish well for the TCM industry. I also
Yes.
want everyone to do well so
Yes.
that the industry can grow as a whole.
Yes.
Right? But it's quite discouraging when you hear that certain experiences were just lackluster and then they didn't really understand what they were going through. Sometimes
Yeah.
it's even painful and
Yeah.
agonizing, and which caused them to have a trauma about TCM.
That's right,
Which
yeah.
is quite sad, right? Because
Yeah.
sessions with me were never like that. How
No.
come nobody ever complained that their sessions were traumatic here?
Yeah,
So
that's why my
just-
followers also are like, oh, I had this negative experience about TCM or had a negative impression of it. But then when you kept on talking about like Victoria and like, because
decided to give it a try.
They decided to give it a try. And also because like they could see that you're young and smart and like, modern in your outlook and all of that. And then they were like, oh, why not? And then they realized that actually it's not painful, it's not scary, it's not old fashioned, and it
Yes.
really does work.
Yeah, it's all about trying to push the power to the patients to really decide for themselves what's best for their health.
Yes.
And that would have to come with a lot of patience. Like, you got to think in the perspective of the patient.
Yeah.
Because many doctors, they just, they probably don't do that enough. So they're just saying, okay, you have this, go lie down. Or we're going to do this. But I think on the patient side, it's like, why am I doing this? You got to
Yeah.
first tell me why am
People
I
wanna
doing
know.
this. Yeah,
Yes.
and people want to know, right?
Yes.
So even if I'm a patient at another doctor place, I would want to know what's wrong with me. So that's how really I think that is what is the difference maker.
Yes, awesome. So another question for you is, in your career, I have seen your clinic. In the short time we known each other, like maybe a year
Year,
plus,
yes.
like a year or 2 years, I've seen your business expand, and you as a person, I love talking to female entrepreneurs, right? I love understanding about like your plans for your business. Like, what is your process? Like, are you somebody who has a very clear 1 year, 2 year, 3 year plan for how you want to grow your business? Or are you somebody who kind of like goes along with the flow and makes it up as you go along? And also, what are some of the productivity tools or tips for our viewers that you can share?
It's a little bit of both actually.
Okay.
Because at the start, when I set up the clinic, I would go with the first approach, right? I had an end game. So everyone has an end game, right? You
Yeah.
want the clinic to turn out like that,
Yeah.
A, B, C, and then you set action plans to get there, and they will be broken down into like quarterly plans. So every quarter you have to achieve a certain, maybe develop 3 products, okay, and then the list goes on. So
Every quarter you develop 3 products.
Yeah, so maybe that's-
Superwoman.
so that's the plan. That's the plan, and you try to achieve that. So that's the first approach, right? But I'm sure the entrepreneurs will agree with me. Number 2 will have to kick in
Yes.
because things just don't go according to plan.
Yes.
Many times, right? And sometimes what you think is best for the patient, like, oh, my patients will love this. Maybe it's not what they need at that point in time.
Yep.
So then you will go with the flow. So you will see on the ground what is current healthcare needs, what is something that the clinic can come up with the current resources, and then you set plans to get there.
Yep.
Yeah, so it's a little bit of mix, but I guess the overarching philosophy is that for me, at least, there is a painting of the whole clinic, like what it eventually is about to become. So obviously we know there are long-term and short-term goals, and the whole painting is like, you look at the artwork, right? You want this to be, you want the whole vision to be like a medical center where people go into different departments, and then they get to see the specialties that they want to seek help for,
Yep.
and etc., etc. So with that goal in mind, then long term, maybe 3 year, I have to open how many clinic, and then short term is within this year, I have to increase my patient base by how much.
Right, so you
it's-
work backwards.
Yes, it's definitely a work backwards for me.
And how did you set that goal in the first place, that your revenue target or whatever it is projection?
That projection is actually through experience, because I worked previously at other clinics before.
Right, okay.
So with the experience, you kind of bring that a little bit into what I'm doing now. Of course, you take the good ones, and then you kind of learn from the bad experiences
Right.
as well. So sort of set realistic targets, to see. And at the start, actually, it was quite a wild plan. When I started planning for the clinic, we had to set aside, for me, I was like, okay, I told Jeremy, my partner, right? So I said, we need to have enough to sustain us for 365 days, assuming we have $0 income.
Huh.
Yeah. So
Wow.
all our running costs, right? All that in 365 days, assuming we have no money in.
Wow.
So that is our backup plan. Because I still want to keep my business running, right? Even
So
if I'm not
you
earning.
wanted your cash buffer of like 365 days of zero income.
That was a bit ambitious, I know lah. Because then we were thinking, then he kept questioning me, say, "You sure or not? We got one day no money." I was like, well, we try to be a bit ambitious lah if we
Yeah.
can. Yeah, but obviously you need to have that buffer. Yes, because things don't always go according to plan.
Yes.
And not everyone's going to pay up every day,
Yes.
like your suppliers and then
Yes. Yes.
So that's how that's how the projection is.
I feel like I should get you to do like a financial planning
Don't
course.
find me. I'm too wild. I'm a wild cat.
And then, okay, so then like what's your favorite productivity tool that enables you to be so focused on what you do?
Yes, I think time blocking is a great technique.
Yay,
I think
time
blocking. Yeah, you
blocking.
talked about that before. So time blocking is something I do all my life.
Uh-huh.
I didn't realize I was doing it until you talked about it. I was like, hey, that's what I'm doing.
Yes.
So, you have a set amount of tasks.
Yes.
You don't have to set that time to that task, but
Yes.
that whole block is, that is blocked out to achieve
Yes.
that number of goals.
Yes.
So basically, if I have to reply an email, to create a patient MC, to do a memo, okay, then
Yes.
I'll be like, okay, I have a 15-minute later, so this is what I'll be doing in that time.
Right.
Yeah, so
Yes.
I'm always constantly doing that.
Yeah.
Every day of my life.
I totally believe in it. So the time blocking is essentially, instead of having a to-do list, you just like get all that to-do list and just put it on your calendar
Yeah.
so that you know when it's going to get done.
Yes, and then of course you choose your priorities. Lah.
Yes.
Yeah, based on the amount of time you have as
Yes.
well.
I love it. Well, thank you so much for coming on Comfort and Growth. We really loved having you here.
Thank you
And
so much.
Yeah, I hope that we can do more future collaborations perhaps for our audience.
We shall.
Yes, we shall. And we'll release more details on our Instagram as well. But it's been a pleasure to have you here, Victoria.
Thank you very
I hope to
much.
share you with all of our listeners, and I hope everyone is inspired by Victoria's journey, and also to keep an open mind. And if you've never tried out TCM before, it's a wonderful part of self-care. It's part of my routine. I firmly believe in every type of TCM, from taking herbs to massage to acupuncture to everything. And I think it's part of our very rich Asian heritage as well. That as that is something that we are really proud of. as Asians that we have this
Amazing.
like technology at our disposal.
Yes.
Yes.
And I'll see you next time at the clinic.
Yes, I'm going to see you always. We have a regular date. All right, everyone, take care now. Bye.
Bye.